So there are two main things that we think about in the management of cardiac amyloidosis, and this is why it is particularly important to have a multidisciplinary team. So you have the management of the plasma cell clone or the plasma cell disease, but also the management of the cardiac disease and the symptomatology related to that. I'm a hematologist, and so in thinking about the management of the plasma cell clone, we have great therapies now with the advent of the dara-CyBorD and CyBorD, which we heard about a lot at this conference. Very exciting work with the Andromeda trial. There are other agents that are used as well, but specifically to manage the plasma cell clone, which produces those light chains that then subsequently form oligomers and amyloid fibrils. There's also the management of the cardiac disease, which we rely strongly on our cardiologists for, in addition to managing the fluid overload that comes, sometimes patients with blood pressure changes. There are many different things that need to be managed. And so in conjunction, hematology, cardiology, managing cardiac amyloidosis, that is how we usually manage the disease. I would say in terms of unmet need, one of the major things is predicting the risk of not only cardiotoxicity, but the risk of developing amyloidosis. And I'm so excited to see that there were many talks. I'll highlight Ray Comenzo's talk on just looking at what are the molecular sequences of these light chains that could potentially predict that a patient with monoclonal gammopathy of undetermined significance will develop AL amyloidosis. That is particularly important because we can now begin to diagnose patients much earlier and prevent patients from becoming or presenting with advanced cardiac amyloidosis, which is quite difficult to manage because patients are so symptomatic and may not tolerate some of these very effective plasma cell-directed therapies. So this is definitely an area of unmet need, and predicting risk is very important. The other I would say is, and this is also linked to predicting risk, is really earlier diagnosis. As we know, many of these patients with advanced cardiac amyloidosis have a very high mortality in the first 6 months and are not able to tolerate some of the therapies that are even in development now. And so it's very important that we focus on predicting risk and also early diagnosis.